The diabetes and weight loss drug semaglutide significantly reduced symptoms and improved quality of life for people with obesity and the most common form of heart failure in a recent clinical trial. So we want to talk more about this and what this could mean for people with heart trouble. Our guest is Dr. Fahmi Farah. She's a cardiologist and a friend of the program. Fahmi, welcome back.
Thank you for having me, Tim.
What type of heart disease are we talking about here? Is there one specific kind?
When it comes to semaglutides, we're talking specifically about heart failure. It is one of the indicated medications for patients with heart failure.
Are researchers saying that this is only an option for people with obesity or anybody who suffers from that type of heart condition?
So it's not just people with obesity. It's when somebody gets diagnosed with heart failure, it's irrespective of obesity. It's all patients with heart failure.
Got it. Today on Portland's Afternoon News, we're talking about a new study of a weight loss drug that may have a side benefit for certain heart conditions. And again, with us, we have cardiologist Dr. Fahmi Farah. So, Fahmi, how much faith should we put in this study? Is this a case of Big Pharma putting money into research that then in turn promotes sales, or is this legit?
No, this is actually a legitimate study. It's not something that's just promoted by Big Pharma. It's something we've known for quite some time, actually. And in fact, we have modified our practice. I'm not talking about just myself. I'm talking about when I say I'm talking about all cardiologists, like not just here in the United States, but even in Europe and rest of the world. There's something called guidelines, that we follow, and those guidelines get updated every year. Those guidelines are set up by certain colleges, like American College of Cardiology and then European Society of Cardiology. Those people are the ones who look at these different studies, the quality of these studies, and based on the outcome, we determine whether this is something that will be changing our practice or not. And so this group of medicines, semaglutide, that's been implemented in our practice quite some time ago, before even this study came out.
So am I to take it that weight loss drugs are something you consider using with your patients now?
Those are two separate entities. When it comes to weight loss, obviously there are some people, like weight loss weight gain and morbid obesity. Obesity is a risk factor for heart disease. And so, of course, weight loss is encouraged, and especially those who have very difficult time losing weight, those who are not able to exercise, those who are have morbid obesity, they all qualify for certain, help with medication. So yes, I do. I do think that those who qualify for it should be offered the weight loss medication.
And I want to make sure I understand, because I've seen lots of ads on television, heard them on the radio as well, about medications that aren't specifically designed for heart patients but seem to have a side benefit, at least according to the manufacturer. Is that what we're talking about here when you do prescribe a weight loss or recommend a weight loss drug to a patient? Is it because it has a side benefit for their heart condition?
There, in many cases, yes. Weight loss is something that's encouraged to mitigate your risk factor from having heart disease. And so, yes, those who have already other risk factors like, high blood pressure, diabetes, high cholesterol, already they're at high risk of having heart disease. And if you add obesity to that, obesity oftentimes is the key player in even having any of those risk factors. Like obesity, for instance, increases the risk of somebody having high blood pressure, high cholesterol, diabetes, all of that. So obesity most certainly is not something that should be ignored. So yes, to answer your question, we do encourage weight loss. And for those who have difficulty losing weight, we do encourage them to get on weight loss medications for all of those reasons, to reduce their risk of having all of those risk factors, and ultimately, of course, reducing the risk of having heart disease.
But it sounds like you're saying that beyond the fact that the drug can help them lose weight, and there are benefits to losing weight, that it doesn't in any other way affect their heart condition.
Not for somebody who doesn't already have pre-existing condition like congestive heart failure. So, the specific class of drug we're discussing here is semaglutide. No, having somebody who doesn't have the diagnosis of heart failure they will only have the benefit of weight loss here. It's not going to add any additional benefit to heart per se. But for those who already have the diagnosis of heart failure, the benefit is twofold. It will help them reduce weight, it will help them mitigate risk factors, and it will help them with their improve their congestive heart failure as well.
All right, understand. Hey, we've been talking to Dr. Fahmi Farah. Fahmi, thanks for all the time today. We appreciate it.
Thanks so much for having me, Tim.